Hi, I'm Dr. Titus Duncan. What I'm about to show you is a video, a very brief video of the intragastric balloon. The intragastric balloon is a weight loss procedure that's non-surgical. And it's usually for those patients who have a little bit of difficulty in losing weight with just medical management or just diet pills and things of that nature. We place the intragastric balloon inside the stomach. It takes up space, allowing the patient to eat a whole lot less. So you're going to watch this video, and we hope to be able to convince you that if indeed you're having problems with losing weight, that this may be a procedure for you. It may not be a procedure for you, and that is something that you'll have to decide for yourself. So I hope this is an informational video for you, and I hope you get something out of it. And if it is, you can contact us at peachtreebariatrics.com, and we hope to see you soon and hope to be able to talk to you about this new procedure, the intragastric balloon. Talk to you soon.
We started at 7:33.
This is us doing the balloon, insertion of the intragastric balloon in order to control a patient's weight. With this operation, well, actually with this procedure, patients can lose a certain amount of weight depending upon their activities and their behavioral change after the procedure is accomplished. The FDA allows us to keep this balloon in for approximately 6 months, and with dietary visits and exercise visits afterwards. The balloon is proved to be effective in controlling a patient's weight to lose a certain amount of weight after it is placed. Usually patients can lose anywhere between 10 pounds up to around about 30 to 40 pounds after it is placed. So you'll see us as we're putting the balloon in. Now what we're doing here is we're taking a look inside the patient's stomach before the balloon is placed, just to make sure that there are no abnormalities in the stomach, and to make sure that the patient doesn't have a significant hiatal hernia, because if they do, then that's a contraindication to putting the balloon in place. Now, with the balloon, at the end of this long insertion tube, the balloon is then passed down the patient's mouth, into their esophagus, and into their stomach for a certain distance that has been pre-measured, and it is then easily placed into the stomach. So we place it a certain distance, and once it is in this distance, we then replace the gastroscope, and that gastroscope is then placed to look at the balloon, and we begin the process, where that process will inflate the balloon with saline to take up space in the stomach.
Look good.
Okay, all right. Kind of get it out there with this thing here. Go back to the monitor. out of that bag on here.
Mm-hmm.
This is gonna make this finish, okay?
Yeah. Next, John Singleton over here.
So now you can see the balloon being insufflated with the saline. There's a little blue dye in there, and that blue dye serves as a purpose so that if the balloon happens to rupture, which is extremely rare, that blue dye can get absorbed into the system, and you'll start to urinate blue dye. It's not toxic, and you can tell the doctor, hey, listen, my urine is coming out blue, and then we know to go in and take the balloon out, which is not dangerous at all. But it lets us know that balloon has the integrity has been violated. Here you see more of the balloon again being filled up. And eventually, once we get to the size of the balloon will hold a certain number of cc's, usually 600 to 700 cc's, which is about the size of a small grapefruit. And we're satisfied that this balloon will roll around freely inside the stomach and make the patient feel full most of the time. Then the procedure will be over.
It's 10 o'clock.
And actually, this balloon insertion takes around about 10 minutes to perform. So it's not a very complicated procedure to do, and it doesn't take very long. As you can see, it's a beautiful thing. It's nice and round and nice and sturdy. So basically, this is where it's connected. This is the machine that pumps the fluid through this little small tubing that's connected to the tubing that goes into the mouth that then is connected to the balloon.
Okay, trust me. You like to work.
And again, once the tube is nicely filled, that tubing is then easily detached and removed, and the balloon stays in place. So you can see now, the balloon is being filled, and it's almost completely filled. And the tubing has been detached.
You all right, Dina?
We're just checking it to make sure it is in good position. And it seems to be in great position. The tube has been removed from the mouth.
Right of your head, right quick. Yeah.
The balloon is still in place. And we are now pulling out the endoscope. And the patient is under light sedation, not completely asleep. We'll be going to the recovery room and go home in about 30 minutes.
44.